Today, let's talk a little bit about anxiety. So, anxiety is something that many people deal with. This is really one of the main topics I talk to with clients in therapy, especially with our current political climate. People are constantly having some type of fear that is plaguing them on a daily basis, causing some sort of anxiety. So let's just talk about what anxiety is. I define it as a fear of the future. But to be more specific, it's your body's reaction to something that you find scary or threatening. And so this can be thoughts of, having anxiety about your job, so work anxiety. This could be anxiety from a relationship that you're in, not knowing where you're going, or if you're having some conflicts within the relationship, this can cause a certain level of anxiety. Sometimes anxiety is normal. It keeps us as animals it keeps us alert. It keeps us aware. It keeps us from getting hurt or putting ourselves in danger. So there is a level of anxiety that you want. But once that anxiety gets too frequent or too severe, you want to try to get assistance with it or try to manage it in a way so that it doesn't interfere with your quality of life. So basic symptoms of anxiety is when you find yourself just being worried about things uncontrollably. This is somewhat when you hear of women who have recently had a baby and they are dealing with different anxiety, like postpartum depression. You're worrying constantly about something happening to your child. This causes a severe anxiety, and again, we call that postpartum. And honestly, it doesn't stop when the baby is small. This goes on even when they're 30 years old. You have an anxiety because you can't control it. And so that fear or that constant worry, that's a sign of anxiety. So excessive nervousness when you're driving or when you're riding on a plane, sleep problems, if you're finding yourself waking up at the same time every night, muscle tension, poor concentration, if you find that your heart is always beating super fast, out of nowhere, you find a decrease in enjoyment in activities you used to love. If you used to love listening to music, if you used to love riding the bike, and now that gives you anxiety or you just don't enjoy it anymore. And upset stomach. So digestive issues can be sometimes a sign of anxiety. There's other signs of anxiety because people are different. So some people have an increased urination when they're going through anxiety. Some people have your leg may shake, your eye might twitch. So everyone has a different way that anxiety is shown for them. So there are different types of anxiety, and it's important to know which one you're dealing with. So you can have a generalized anxiety. And so this is it's when you have a excessive anxiety or worry in several areas, like I listed before: work, relationships, finances, or your health. Say you got a diagnosis in some area and that has sent you maybe on a spiral of anxiety. Also, there's phobias, very, very different than generalized anxiety. So this can be an intense fear that you have about an activity, a certain type of person, or it could be a thing. Like you can have a fear of spiders, a fear of clowns, a fear of flying. So phobias come in many different areas. Last, panic anxiety. This is more of an extreme version of anxiety. This is when you hear people tell you to breathe in a paper bag. You have different physical symptoms that come along with the panic anxiety. There are medicines that can help alleviate this, but the more classic things are the breathing techniques or grounding yourself. And we'll talk about a couple of those just so you can have a couple of tools. The biggest issue with anxiety is people typically try to bottle it and push forward. Stop bottling. Deal with the situation so that you can move forward. Because when you bottle, eventually the bottle is going to be full. He knows what happens then. So you want to not just avoid it because it's going to intensify that anxiety eventually. Sometimes when you avoid it, and avoidance can look like many things. Avoidance can look like you utilizing alcohol to get rid of it, drugs to get rid of it. These things, they may give you relief for a moment, But again, that's just avoidance. It's going to come back. So let's talk about ways you can manage it. Of course, as a therapist, I'm going to tell you therapy is a sure way of really managing it and having the support you need to properly manage your anxiety. With the therapist, they can identify what the triggers are. They can help you think about if there are past things. Because again, anxiety is fear of the future. I typically look at depression as pain from the past. Sometimes that pain from the past can trigger things to give anxiety, where that's fear of the future. Having a therapist help you navigate your way through those past experiences can help you to eliminate some of those future anxiety episodes. It'll give you more confidence, and you will feel like you have more control if you utilize the assistance of a therapist. Another way to manage your anxiety is lifestyle changes, healthy habits. Not having, a schedule that's kind of sporadic. Consistency really helps with managing anxiety. So making sure you're sleeping at a certain time, eating at a certain time, as consistent as possible. Exercising, moving your body. This will help relieve some of the stress and anxiety, it's a very, it's a better way of managing than utilizing those, again, alcohol, drugs. So exercise is a really good tool. Work-life balance is another major thing. And I personally, for myself, I would tell you work-life balance is very tricky because there's no balance in work and life. It's really work-life boundaries. So learn healthy boundaries. These healthy boundaries can also be implemented when dealing with friends and family, drawing lines, being able to say no, being able to enjoy life to its fullest. That's what healthy boundaries are about. Other things you could do, relaxation methods. Again, this is the breathing techniques that you often see people encourage people who have an anxiety attack to do. So breathing in a bag, breathing in, breathing out, those techniques always help. Muscle relaxation. So you can start from your toes. So squeeze your toes, squeeze your calves, squeeze your thighs. Just keep going up your body. Squeeze your butt muscles, your back, your arms, and then you relax. You can do that one at a time, or you can just tense your body and just relax just until you start feeling better. Another favorite go-to relaxation skill is the 5, 4, 3, 2, 1 method. So this is when you name 5 things you can see. Like I can see the blinds, the couch, my computer, my drink on the table, my pocketbook, so on and so forth. Then you call out 4 things you can hear. You call out 3 things you can smell. You call out 2 things you can touch, so feel. And then you call out 1 thing you can taste. So whatever that may be. Now, depending on your environment, you might need to change some of those up. You may be more around more things that you can touch than you can hear. So you do that until you're feeling better. So those are just a few examples of things to help you relax. What they're doing is bringing you back to the present, grounding you to now. Anxiety, again, is fear of the future. So you want to tell yourself, I'm okay right now. I'm here right now. So you want to get yourself grounded there. The last thing that can really help with managing anxiety is medication. Now, a lot of people do not like taking medicine, but I have found that with anxiety, it doesn't have to be a long-term medication. In some cases, it may have to be, depending on the severity. But if you are going through just a season in your life where you have more anxiety than normal, it can be just maybe 6 months, maybe a year, maybe till you get to the point where you can properly manage by yourself. There are different medications. Some people react differently to others. I do tell people at SSRI, and please look that up. Seems to be the safest for many clients, but your body may react differently. So talk to your primary care doctor about that. So putting medicine and therapy together can double the amount of time that it takes for you to feel a difference with your anxiety. But ignoring it is not going to get you anywhere. So do something. If you have anxiety, treat it somehow. Get therapy, use these meditation and breathing and relaxation skills, change your lifestyle, figure out what is your trigger, what's making you anxious. Utilize medicine if needed. If you can put all of these things together, your outcomes will be much, much better. So I hope this helped. Hopefully you will have less anxiety with using some of these tools. And wishing everyone a balanced career, life, and love. Take care. Bye.